Surgery as an infertility treatment for women is not nearly as common as in the past. There are still some cases in which surgery is a good treatment for women with infertility. Make sure you stay to the end for the complete story. Surgery for infertility can be divided into two main areas: surgery inside the uterus and surgery outside of the uterus. Surgery inside the uterus is performed with a fiber-optic scope called a hysteroscope. The doctor looks inside of the uterus through the hysteroscope, which is attached to a video camera with a monitor. The types of problems that can be fixed with a hysteroscope include growths like fibroids or polyps, scar tissue, and abnormalities in how the uterus developed. One common example of this is something called a uterine septum, in which tissue divides the uterus down the middle so that the uterus is split into two smaller halves. Hysteroscopy is a non-invasive surgery. It does not usually require an overnight stay in the hospital, and most women will be able to return to their normal activities by the next day. Sometimes problems can occur outside the uterus, which can interfere with fertility. The most common problems are endometriosis, scar tissue, and blocked fallopian tubes. Surgery for these problems can also be treated with a fiber-optic scope called a laparoscope. Instead of going through the vagina, this scope is inserted through the belly button through a 1 centimeter incision. Additional instruments can be placed through additional incisions near the pubic hair line. Depending on how much is being done, some women might end up staying in the hospital overnight, but most of the time they can go home right after the surgery. The amount of time they will need for recovery is also going to vary based on how long the surgery took and how much was done. Most women will need at least a few days before returning to normal activities, and some might require a week or more. If you like this video, remember to like this video. Do you have a question? Leave it in the comments. We'll answer. Subscribe to new episodes of Infertility TV weekly. Click the link in the description to visit our website where you can register to become a patient.